Hello, everyone, and welcome to our panel on the coronavirus, the novel coronavirus COVID-19 for the New England Graphic Medicine Virtual Summit. I am still your co-host and organizer, A. David Lewis. Today's panel is going to be a little different than the other ones. We're going to hear from two presenters, and then, of course, do a Q&A with them based on feedback from the attendees in the chat area. However, after that, we're going to be trying to coordinate just a general discussion, thoughts, feelings, information about the crisis as it's unfolding right now. So we're going to shift this from the panelists to basically the attendees thereafter. This is entirely optional, and this is a public space. So we will be asking everyone to regard each other's opinions, feelings, identities, labels, and so forth. Before we have to contend with that, however, it's my pleasure to welcome our two panelists. We will first be hearing from Alice Jaggers and her cat Shadow. Maybe not hearing from Shadow. But she is going to be speaking to us today about COVID comics. Alice, floor is yours.
Okay. Okay, it's not letting me open my slides. Having some technical difficulties.
You're not. We will assist you.
There we go. Okay, now it's there. Okay. Good deal. So COVID-19 comics, graphic medicine. It's a really frightening time. Something that, so I did have, I had a couple of courses in microbiology in my undergrad days, and one of my professors in particular was always stressing, pandemic, it's not if, it's when. And so I think I kind of had a leg up on some people for kind of getting a feel for what might happen and how to prepare. And so when this all started happening, the graphic medicine website group, Ian Williams, Matthew No, MK Serwick, and I, kind of, it's like, okay, we need to do something. And so I put together some there were so many, it was overwhelming because there's so many, I couldn't just put everything up there because there's just too much all at once. But the biggest thing was organizing it. And through organizing it, I kept seeing these parallels between all these, the coronavirus comics and how they kind of relate to graphic medicine in general. So what happened was, especially as we kept getting more and more comics, we kept seeing that the coronavirus, the COVID-19 comics are kind of almost like a microcosm of like a mini example of graphic medicine as a whole. And so as I organized the post, the website, the site on graphic medicine, and then reorganized it. And of course, I've had a lot of help from MK Serwick with helping me update it, and a lot of help from Matthew No, sending us stuff to send it. And of course, you all too have been sending us some great stuff. So, so I am Alice Jaggers, and I help co-run graphicmedicine.org. And I also have a blog, alicejaggers.wordpress.com, in which I talk about graphic medicine. And you can find me in most places, Instagram, Twitter, etc., Twitch even, ajaggers324. So the biggest thing I found are these similar themes, that these are themes that I had written about and presented about before, and now have seen paralleled. And I'd written about it in graphic medicine, and I could see this paralleled. And so this is our current organizational system for the graphic medicine post on COVID-19. So we have first educational, then ethics, which was social justice, and we've kind of just expanded it. So it's still social justice, it's just also ethical things in general. So care providers, healthcare providers, comics from patients, humorous and coping, which they're related and kind of they're similar but not the same. And yes, the Jaggers themes, I like that. And then last historical, which is also pretty educational. And something you will also hear me say a lot is intersectionality, and I'll have a slide on that in the end. But for the most part, most all of these have some amount of overlap, that each comic isn't necessarily going to fit into one easy category. That's definitely true of graphic medicine novels, longer works, even zines. Sometimes with these COVID comics, because the ones that are out right now, they're shorter, they can sometimes be categorized into boxes more easily, but still these kind of defy themes. So what or categories. So what this really is about the purpose. What can they do? What are the benefits of the COVID comics? What are they bringing to us and relating that to graphic medicine as a whole? They're providing us better access. And this is stuff that I've heard in the workshop this morning with Liz and Beth, and then also with Brian, what he was saying about the different kinds of benefits that you can get, the different reasons that you read graphic medicine or that you make graphic medicine. So I am definitely going to highlight here, so graphicmedicine.org, this is our COVID, and we link to also the COVID comics, COVID-19 comics website as well, and to other places that have also tried to short run, places that are collecting comics. So we're trying to kind of become a hub, kind of become a resource. So we have examples of everything. Yeah, thank you, Dave, and for putting that in the chat. And we're trying to become a resource for COVID comics, a place you can go to kind of jump off. And so we're not, of course, presenting like, here's information. What we're providing access. And big shout out to MK Serwick, who keeps helping me update things. There have been several times where I'm like, oh, I need to add that. And then MK's already added it. I'm like, okay, well, never mind then. But we started it March 12th, which was actually, so I started my own self-isolation on March 6th for health reasons. And so March 12th, that was when I think everything kind of started really ramping up. And it has gotten a lot of attention, and I mean, which is very important. Okay, so educational, I started off, this one's actually directed at children, the kids educational. That's a lot of people who don't know as much about comics kind of assume, oh, wow, you can use it for teaching. Oh, good, teaching kids. And that's kind of where they first jump into it. Obviously, there's a lot more than just that, but that's kind of, so first, the example, and how I will be doing this is I will have at least one example from the COVID, and I'll have one example comparing that's in graphic medicine in general. So we have the Just for Kids, a comic exploring the new coronavirus, which came out on NPR, and basically that shows, and so many people that haven't really known about comics before or didn't know the benefits of comics have seen this and gone, oh, wow, this really does communicate what's going on with coronavirus. And I've seen a lot of people like, well, I know it says Just for Kids, but as an adult, I got a lot out of this. And it's, well, yes, it happens a lot. And so educationally, having there's a lot of research that has been done on whether or not comics help kids learn. That's a lot of the research? And the answer is yes, that it definitely, people or children learn that well that way. There's less that has been done on adults in comics, but it's my own personal bias that it definitely helps. That's for sure. And so one of the things that having these educational, even though they're educational, they generally have a narrative. They have a story, and stories stick with us. So the information sticks with us better than just a simple infographic. But if an infographic has a story, then it's going to be it's kind of a system to it that it's going to be easier to remember. And so that's what this educational, and you can find that on all of the coronavirus examples you can find on the graphic medicine site. And so comparing that to The Amazing Captain Fit, there are quite a few comics, especially about wellness, about healthy eating, but also about diabetes and Crohn's disease and other sorts of things that children might get that they don't understand. There's so many that that present topics that might be more difficult to understand to a child. Having a child protagonist have something that's relatable to them so that they are more interested. And so that's what The Amazing Captain Fit, which was actually, so this is provided, this conference is provided by the New England region of the National Networks of Libraries of Medicine. The Amazing Captain Fit actually was funded by the South Central region. They're in Louisiana. And so, and actually you can still access that online for free, but it tells a story of a child as he understands about eating healthy and how that helps him. And so you see this, which I think a lot of people would expect. Well, yes, graphic medicine has educational for children, but you also have education for adults. And I will, at this point, give a really big shout out to the NIB, because there has been quite a few comics coming out of the NIB that are mostly talking, there are some that are educational. This one's talking about debunking some of the myths, but they're very funny, and they typically more go in the humorous coping section, because it's a lot about how people are coping, how emotionally they're feeling about all that's happening, the isolation, the especially for healthcare providers and patients, you know, when they are exposed. And so this is kind of in the similar way. It's teaching you, it's telling you a story about how to understand what people are going through, and telling a narrative that helps you understand. Most of the educational stuff, it's going to connect with at least one or more of these categories. For the general graphic medicine, so connecting it to graphic medicine as a whole, you have quite a bit actually of educational that are targeted at adults. There are quite a few things that are targeted for like med students or other students of healthcare, but healthcare at schools. But you also have things like Rock Steady, Brilliant Advice for My Bipolar Life by Ellen Forney, where this is very intersectional with coping, because she's also kind of giving you advice on how to cope with having, I mean, she's specifically talking about bipolar disorder, but it also is very good for depression, anxiety, or really anyone who's dealt with any sort of difficulties. And right now, with the pandemic, that's everybody. And so she has Smedmertz, which the adorable mascot there. And those are her sleep, meds, eat, doctor, mindfulness, exercise routine, tools, and support system, that you actually see a lot of those themes over and over in a lot of the coping comics that are for coronavirus. So ethics, and here these are actually very much social justice and getting across something that in these difficult times that we still have to maintain ethics. We have to do things that are right, and there have been a lot, and this is so this that was posted on Instagram by Rachel L. House about whose lives matter, and this is from March 9th, so it was really early on, and the rhetoric was definitely that it was only older people or immune compromised. That has been shown to be false. We have young people with no coexisting complications, medical complications that are dying as well. But the sentiment here is kind of, well, who matters? Whose lives matter and who are just statistics? And that is a really important ethical thing to consider. And of course, now, as people, as hospitals are running short on ventilators, it's the question is who gets the ventilator and who doesn't, and what are the ethical questions there. And so ethics is not a really a topic that a lot of people absolutely think is fascinating, other than my good friend Leah Eisenberg. Shout out to Leah. But so there aren't as many comics specifically about it, but one that I absolutely adore is Whit Taylor's Black Mothers Face Far Worse Health Outcomes and How Do We Fix It? And Whit Taylor is absolutely amazing. And right now, she is going through a lot right now. And you can see some of the stuff if you follow her on Twitter. If you follow her on Twitter, you can see because she is pregnant, and COVID's definitely hitting her hard in terms of what she's going to do, what she has to do. But this particular NIB article is NIB comic is from before that, and it's actually kind of touching on Serena Williams and how Serena Williams actually was in a life-threatening position, and it was only because she became belligerent and insisted on medical care that they were insisting that she ignore, that it saved her life because she did have a blood clot. And if this can happen to someone who is a superstar, she's greatest in the world in tennis, has lots of money and is extremely famous, and yet she even had these biases. And so it's a very strong ethical concern of are people getting even treatment, equal treatment. And of course, if you read Black Mothers Face Far Worse Outcomes, it's very clear that they do not receive equal treatment. And so what can we do to fix that? And that's a sentiment that you see in before in general and graphic medicine. You can also see paralleled with COVID-19 right now, and people not receiving equal care. Okay, so comics by care providers. This is a huge one in general graphic medicine. I could have chosen from dozens of examples. I went ahead and went with Ian Williams, Bad Doctor, and as my general example, but there are so many examples of comics that are from a healthcare provider's perspective. Doctors, nurses, physical therapists. I mean, there's so much that you can learn. I mean, even from staff. And so this is a big thing that is used in medical schools, so you can kind of see for different perspectives, but also helps patients kind of see from a doctor's perspective or physician's perspective or a nurse's perspective. And most of the ones that I have seen from a healthcare provider's perspective are from Grace Ferris, um, Nathan Gray, and I'm blanking on names. Oh my goodness, I didn't write that down because I was like, oh, I know their name. Mike Natter, ha ha ha. And Booster Shot Comics. Those are the kind of the ones that I've seen. But even Mike Natter has kind of put this on the back burner because Alex Thomas, yes. That's just shout out really quickly to chat. Melinda Barrett is my mom. So hi, Mom. Very professional here. And but so, and as Mike Natter was saying, that he has to put this on the back burner because there just isn't time. These heroes, these people that are risking themselves to continue to work in these really scary times. And so I have a feeling that we will see a lot of comics by healthcare providers after the pandemic scariness has passed, but probably not as many during, just because they just don't have time to do that, or at least not create it and post it. But this one in particular by Nathan Gray really struck me because it also, again, with intersectionality, shows a position of a patient who was not able to see her dad before he died. And so this is text is adapted from Vital Talk, which is communication skills, and they Dr. Gray made a comic based on their guide. But this is a reality, that your loved one, that you don't get to see them, and this is just, for me, it's a very powerful comic. So, okay, so my slides just went away. Is that true for everyone else?
Yeah, they went away from me too.
Oh, it's back. It's back.
Yep, they've been reactivated. Carry on.
Okay. And comics by patients. So a little bit about me. I've been not very public about this, but somewhat public, that I am undergoing IVF cycles. Well, I say that it's on pause now because all fertility, any fertility treatments are currently on pause because of the COVID virus, that the risk of infection, to decrease that, also that those medical supplies could be better in hospitals rather than in a clinic. And so, and I've actually been following Myrtle Infertile. I've been following Myrtle on Instagram for a while and following her IVF cycles. And this was very much kind of how I felt when everything going on. It's like, oh, well, we're going to have to pause everything. And, here's definitely felt like the rug was pulled out from underneath us. And so I thought that her comics have really have done a good job of capturing the feeling of what it feels like to be under an IVF. So, and I did actually talk to her last night about, hey, it's okay if I talk to your story. And she's like, oh yeah. So, so I don't think she is registered now, but if she's seeing this afterwards, hi Myrtle. And patients, comics by patients, there are so many that we see. So the example I chose is My Degeneration: A Journey Through Parkinson's, which is just a phenomenal book. If you haven't read it, do. The symbolism is just fantastic, and you feel his struggle and the shakiness of his hands, and how he also has that depicted. And I mean, it's just a phenomenal book. And kind of goes back to what Brian Feast was saying with having people, you let them see what it feels like. You let them be there. And that's what a lot of these comics by patients are. I've heard a lot of comments when people read this, like, oh my gosh, I never knew how hard XYZ was, or what that, like, oh, I never thought about that aspect of it. And these really help for other people. It creates communities of patients that all, I mean, I'm saying that I am starting my own comics about the IVF cycle, and it helps me to connect with someone who's also writing comics about that. But also beyond that, for healthcare providers to be able to see, and again, back to what Brian Feast was saying, that, oh, I see now how that might be portrayed, or how I might change things in the way that I'm doing it, to see that perspective. And so these are just incredibly powerful books from patient perspectives as they go through their journeys. And I will also kind of do a shout out, because we don't yet have any comics. I haven't found one. If anyone else has found one, please let us know, MK or I, or Matthew, if you found any comics by caregivers about COVID, because so far we haven't found any. And I think that might be kind of a similar thing to the healthcare providers. They've got their hands full already. We might see more of those after the fact, but probably not as much during, or at least not that they've made publicly available. But I will say that that is also a very big thing in the graphic medicine community, is also seeing the unique perspectives of the caregivers as their own emotions, their own struggles as they go through watching someone they care about struggle. So, okay, so yes, Brittany Netherton is a very knowledgeable, very wonderful individual. So you should definitely go to her class. So this is humorous and coping. I'll start out with a coping, and then I promise, I know this has been very dark and sad. Things are about to get a little lighter. So we've got another by Rachel L. House, where she is trying to do coping, where she wants to stay informed, wants to know what's going on, but at the same time, a lot of the news and on social media, that it's very anxiety producing. This is anxiety producing time for any of us. And so where is that balance? And that's something that is very beautifully portrayed. And if, again, with intersectionality, taking turns is, like, could probably fit in like all of the categories. I don't know. Like, I think I've heard of this MK person once or twice. For those who do not know, I am friends with MK Cerwick, but it is a fantastic book that is definitely about her coping and using, yes, Mortal Kombat, yes, about using comics, creating comics to help her cope with the HIV/AIDS epidemic. And yes, MK Cerwick. And she, and it's just beautiful picture, but it's also a historical. And of course, she is providing her perspective as a nurse, but then also as a patient to a degree, because in a wellness way, because she is talking about her own mental health and on her dealing with the trauma of what she was seeing with the HIV/AIDS epidemic, which does kind of have parallels to now, where you are seeing patients that are wasting away and there's not much you can do. And that's something that's that is as well. So if you have not read Taking Turns, go check it out from your library, if you're a library, or purchase it from a local bookstore. And if you if your library doesn't happen to have taking turns, then request it. So, okay, so I promised levity. So here's a little bit more levity. And so with hyperbole and a half, which is very humorous. So this is a general graphic medicine, and it's called The Motivation Game. And she keeps telling herself to do things because she is depressed and she doesn't want to do it. And so she is talking to herself, saying, well, you can't have, because the motivation, right? You're supposed to reward yourself, do something and then reward yourself. But her other side of herself is saying, right, but I can just do that reward thing and not do the thing because I'm an adult and I can do that. So yes, hyperbole and a half is, well, there's, she does have stuff online, and there's also a book. This was talked about in Brian Feast's that some people thought there was something lost in the physical copy, but at the same time, like this particular story is not online; it is only in the book. So, but she also talks about her dogs and how sometimes they don't know how to dog, and I find those are just my husband. I will talk about Richard for a second, that he was literally fell on the floor laughing when the stories about how she talks about her dogs. Okay, so Tiny Snack Comics has also been doing a Quarantine series. This is just number 4. I think they have at least 9 now. But they're mostly about being social isolation and the feelings that we get when we can't do what we used to be able to do. So so there we go. So how long has it been? And then you find out, like, wait, where did you acquire the beard? So this is another example of, yes, this is another example of something that is I can relate to for sure, with feeling, because at first it felt so weird, and now it doesn't feel as weird, even though it should. Kind of normalized the craziness that this is, but of not seeing people. And boy, howdy, does this conference make me feel better. And then, so this is second Lena, who decided to draw this about the difference between cats and dogs. And this actually made me a little sad because it says, finally, I was good enough, you stayed, which means that the dogs have been thinking that, they weren't good enough this entire time. And then the cat just being like, well, I do not get this. I do not understand what is even happening here. And I will say that my cat does not agree with that cat versus dog. He definitely up there. He is definitely enjoying the fact that we don't really leave. And he is very happy with how much we're playing and how much he gets to snuggle. That is a definite theme. And you can see his white belly. He has a tuxedo cat, and so he is definitely not in that cat category of why he's the finally I'm good enough. So, And also the Awkward Yeti has done, again, quite a few. Definitely, if you haven't checked out the Awkward Yeti, please do, because the heart and brain stuff especially is really great, his stuff. And there's a book, and of course the book tour has been canceled because coronavirus, but there's a book that came out in March. About, I can't remember the title now, but he has done a lot of these kind of quarantine isolation comics, where in here heart is, so brain is your rational part, and heart, shows you what you want to be doing. So here heart is pretending like he's actually going to a coffee shop. And then Bob Moran, who's the political cartoonist for Telegraph in the UK. This one was published on March 14th. And so this is, especially because early on, people were just buying toilet paper. And it was like, okay, right, but why aren't you buying other things like food? That everyone was just buying toilet paper. And so I thought this was a pretty good commentary on that the people have been not necessarily preparing in the ways that would best serve them. And so I thought this was cute. Okay. So, and again, when watching Brian feast, I'm like, Brian, you are stealing my stuff. Not really. But yes, how I broke up with my colon. Yes. And there are different stories that are both his, but then also from lots of other stories that he's collected from other people. And then he turned them into comics. Thank you, Matthew. And so historical, and we have this. So in our historical part on the post on our site, that we have stuff that is talking about the past pandemics, so no ordinary flu, but also I kind of had, when I was going through to find one that was more general, like I was just like, oh, and then the book, The 1918 Flu Pandemic, or The Invisible War, or Plagues, The Microscopic Battlefield. And it's like, well, okay, well, everything fits into this pandemic rhetoric. But then we also have so I finally found Neurocomic, which is very educational, talking about neurology, but then also going through the history of when scientists discovered things about the brain. So I've already been talking about intersectionality a lot, and so I just want to say that so these are some really good comics, but I mean, obviously there are lots of others that are, most of these are all intersectional, but Grace Ferris's stuff, she's actually been posting a lot about coping mechanisms. So she is a physician, she's a doctor, and and also with her two boys, so coping with children at home. And so that's, and they're also very humorous. And then of course, RX, which could have also been in the ethics category, but then also is talking about a position from a patient's perspective, but then also someone in the healthcare field, because she was working in marketing for medications. And so you're seeing a lot of different aspects of graphic medicine there. And I do want to, I used Slides Carnival, so I'd like to give them credit, but that's more time than I thought I would take. I apologize, but but that is my presentation. Dave?
Jump in here.
Thank you.
So I think the plan was for Darren to go, and then, okay, so I'll switch over to Darren's slides, and then we'll figure out what happened to Dave.
Yeah.
Oh, and we're starting in the middle. Oh, back up. Oops, too far. There we go. And I will get off the camera and turn it over to Darren.
Can you get it to the first slide?
Oh, is this not the?
That's the very end.
Oh, I think we're on a.
There you go.
Yeah.
There you go.
Okay.
So thanks very much. It's actually maybe perhaps I wasn't quite certain why Dave put me in this session, although on one hand, it makes sense if there's a session about coronavirus. I happen to be a pulmonary and critical care physician. That's what I practice. So this is obviously a very trying time, very stressful time for my community and for my patients specifically, obviously in what I do clinically. But that's not at all what Dave had asked me to talk about at this terrific conference. What I was to talk about and will talk about is trying to bring the graphic medicine world into a much more traditional conservative world, that is the traditional medical journal world where clinical science goes on. So that aspect of what I'm actually talking about doesn't really, although we do have some content, we certainly have an enormous and growing amount of hardcore science that is keeping us up day and night as we keep up with that on the clinical aspects of our journal. But that wasn't really appropriate for this conference. So I will talk about, as I said, what Dave and I discussed, which is how it came to be and what our experience has been bringing this kind of medical humanities offerings to a conservative, if you will, hardcore scientific journal. But as I said, on the other hand, it's maybe fitting that I'm speaking in a coronavirus discussion if that's what we're going to talk about, given what I do clinically. So by way of introduction, I want to tell you a little bit about our journal, which is so as to help you understand what the challenges were and actually continue to be as we try to bring this kind of content to an audience that isn't as familiar, but I will skip to the punchline and tell you has been joyfully enthusiastic at accepting this kind of content, which I think all of you, the creators of this kind of content, should be very proud of, and I hope excited. So Annals was established almost 100 years ago. We have a reputation for our methodologic rigor. We have an enormous team of PhD level biostatisticians as well as clinicians from all over North America, including and as well as Europe, that help us to bring what we believe is among the most important internal medicine clinical science to bear. And with that, we are the most, and I tell you this not to brag, but because it's important as we think about bringing alternative content, we're the most highly cited internal medicine journal in the world. We're subscribed to by over 150,000 members. We have entire countries that have subscriptions to our website. So we're written up in major media outlets, the New York Times, multiple times a month, billions of media impressions. That matters to this conversation because when you have something that's really working well, you're pretty conservative about trying new things. You've got a very well-established audience. The medical field, as you probably know, is not renowned for trying out all kinds of wacky new things, if you will. It's got to be tried and proven before we bring it to what we call real time. We do, and have for years, had a section of our journal called On Being a Doctor, which are narrative essays. And we think they're wonderful. That had been really for many years before my colleague Christine Lane and I joined the journal. That was really our major medical humanities offerings. And they're wonderful. They are highly successful. They're edited by a wonderful physician writer, Dr. Mike Lacombe in Maine. But we really hadn't branched out beyond that for very much the reason that I just mentioned. When you've got something that's working and you've got a very well-established reputation, you don't want to monkey with that reputation. So that said, we were toying with the idea of maybe trying a comic. And really just serendipitously, at a time when we were planning a supplement to our journal back in 2012, an entire supplement on on safety issues and patient safety specifically, obviously, that was all hardcore clinical science, randomized trials, cohort studies, the kind of stuff that many of you might find boring and puts you straight to sleep if you're not a clinician. At the same time that we were planning that, Michael Green, who many of you obviously know from the graphic medicine world, who's a physician at Penn State, sent us a wonderful graphic medicine contribution that depicted something that has haunted him ever since he was in his training many years ago. I'm guessing probably 30 years ago. Michael and I think, are about the same age. This just came through the door over the transom at just the right moment, and we had a very heated editorial team debate about whether to publish it. And the reason is that this was a comic, and people were saying, "Are you crazy? We're going to put a comic in the annals." That's going to, some of the words that came up at that discussion is, will it dumb down the journal? We have our medical humanities offerings in the form of On Being a Doctor essays. How could we do cartoons instead of prose? My personal feeling, and this is what ended up being the feeling of the editorial team as a whole, was my feeling was that I absolutely love Calvin and Hobbes, and I reread those. I have ever since I was a college kid. But I don't think that there's anything about the fact that I love Calvin and Hobbes that means that I don't also love William Shakespeare. And so with that idea in mind, we decided to go ahead and publish Missed It by Michael Green, and the reaction was fantastic. These were just some of the comments that came in. Throughout the talk, I'll be showing images of other graphic medicine pieces that we've published. This up here was not from Missed It. But some of the comments to Missed It were, I appreciate the venture into graphic medicine. Graphic arts, it captures the substance and emotion in a unique way. More, please. I hope you'll add more of these. It's serious and thought-provoking. Other comments, a great addition to ways to learn and remember, sort of just along the lines of what Alice was saying in terms of ways to help adults learn. For the clinicians, who that's the vast majority of our readers, when we express things not only by other clinicians but pieces by patients, it helps us to think and learn about other perspectives that maybe we have inappropriately forgotten about. Very effective and powerful, and that people responded very well. So with that in mind, we did go ahead and decide to launch the Annals Graphic Medicine section of our journal, which we did almost 5 years ago, initially publishing just monthly, and the submissions have grown and grown to the point that we're now submitting weekly, and sometimes multiple times weekly. You can see some depictions here of some pieces from people who you will recognize. M.K. Swearick, you can see up there. You can see an image from one of her terrific pieces. Nathan Gray, William Doan has done the piece down at the bottom from a medical student. For any of you medical students are out there, I'll confess I have a real soft spot for medical students. And we absolutely love publishing those because we think those are our future, not only the future of medicine, but the future of certainly graphic medicine as well. Michael Natter, as you've heard of, Sharon Rosenzweig, and we've worked very hard to not stick to a single style. So, for example, you can see in the upper right-hand, your right-hand corner, that's a single image from actually a a graphic medical abstract. So this was the presentation of scientific findings in a purely graphic form. We have, subsequent to that, published an entire randomized trial that was using a graphic medicine form of patient consent for people undergoing heart procedures. And we simultaneously published the cartoon book that was used by the doctors to explain the procedure to patients, as well as the hardcore scientific outcomes in terms of emotional outcomes for patients understanding. And that has had terrific response. So we're trying not to box ourselves into any one specific genre or approach. And here you can see some additional images. They really vary. I know with this audience, I don't have to convince you that images speak louder than words quite frequently. And I think you can see the pain on the part of the families and the clinician here involved in what is unfortunately right now something you're seeing in the news a lot. The pain and suffering of these patients at the bedside, suffering complications of the care that we provide, and many, many other things. Sometimes comical. They're not always color. They're often they're not always just plain art. Sometimes they're colorized photographs. And indeed, we've even, and now, David, if we will, we're going to switch over to video. So we're trying not to only do still art. This is by Sharon Rosenzweig, Aaron Freeman, with music by Torrin Hopkins. So I'd like to play a little bit of a segment of this.
We're going to attempt the switch now. I'm going to ask co-host Sarah if she could share her screen and attempt to activate the video. Please bear with us. This is a good sign.
Doesn't sound like the audio's coming through.
Yes.
So I'll just, for the sake of time, unless the audio is going to work.
No, why don't you proceed, Darren?
Yeah, so this is a terrific story by Sharon and Aaron about their own personal experience. Aaron, having had seizures that landed him in Cedars-Sinai Hospital, was having delirium, and Sharon got to his bedside and became the best possible medication for him to keep him oriented. But then when she went off, he finally came to and was able to be calmed down after these horrible seizures. She needed to leave the room to get herself some food, and we'll be able to see in a moment what happens once this calming effect of a real human being with whom Aaron could connect. The demons came back, the demons of delirium. And throughout all of this piece is original music that was written and performed by their friend Torrin Hopkins. And it's extremely powerful. And I know that I, for example, in my critical care practice, deal with a lot of patients with delirium. And I can tell you, I had never truly grasped until I really looked at this, what it might feel like. And lucky for me, I have not felt what it's like to be delirious. And then Sharon came back, and then it has this great humorous thing, or, this one nurse asking, are these two people allowed? Is this two people allowed in that bed? And the other nurse saying, no, but, just ignoring it and letting it happen. So that was an example of, we don't try to box ourselves into one format or another. There's so much that can be shown graphically. And we've done several videos. Some of them are actually educational videos for patients about going on insulin, for example. If we can go back now to the regular slides, if I'm able to advance, I don't know if I am. So we've also, you've heard now mentioned Michael Natter. We were very fortunate that Michael was here in Philadelphia and one of our medical students, actually, in Philly, and he's now completing his residency at NYU and going on to an endocrinology fellowship. Michael has joined us by contributing regular monthly pieces that he's calling progress notes. The pun there is that the notes that we write in our charts, taking care of patients every day, are our progress notes. But in this case, it's progress along Michael's development as a physician. And so this is one of the earlier pieces that he published in the Annals Graphic Medicine section, where he was at his first code and saw somebody die for the first time. Michael has given us contributions throughout his training as we've seen him grow into he was already a mature and thoughtful person, but an even more thoughtful and more mature and caring physician. Similarly, Alice mentioned, if we can move to the next slide, has mentioned, there we go, Grace Farris, who is a hospitalist at Mount Sinai in New York. And Grace had contributed to us several terrific pieces. One of them that got the most attention was the one called Back to Work, which was about her experience returning to her clinical duties as one of her children was old enough to be left at home after being on maternity leave. And you can see this image here of the doctor pumping milk at work. And so Grace has done a terrific series that's very popular, one a month, called Dr. Mom, where she explores on a monthly basis the trials, the humor, the conflicts that are involved in being a very busy hospitalist, as well as obviously a busy mom with 2 young boys at home. And I do want to keep this somewhat topical to the coronavirus discussion. So many of you may have seen William Doan's work. Bill has done a lot of terrific work with regard to mental health, and we've been honored to publish a lot of it. He just sent us something a week and a half ago, and we published that immediately on his thoughts about people who are struggling on a daily basis with mental illness. Gosh, what happens when you're now taken out of your routine? Maybe you're worried about getting your medications. Maybe you can't go through the things that all of us take for granted to try to keep our own mental health in check, our behavioral health. And he's given some terrific advice for how he's managing it, how he is suggesting other people keeping up with an exercise routine if you can, going through meditation, drawing, doodling. So it was really, really terrific that he was able to do this for the community so quickly, and we were able to get that out to be seen by, quite frankly, millions of eyeballs, given the amount of traffic that the Annals Graphic website gets on a monthly basis. Some of the challenges that we've had, I introduced this on purpose to tell you about the fact that we are a hardcore clinical journal. And I've got financial responsibilities to the largest physician specialty organization in the country. Annals helps to keep the lights on despite the fact we are not for profit, but in order to bring all the educational and clinical science to the physicians that use our material and thus get to patients, we have to keep the lights on. So there are definite publication problems that you run into where the scientific community is generally quite accustomed to submitting work because that's their currency, whereas artists, their currency are hard dollars and cents. And so that's been a conflict. Eyeballs and exposure are what scientists want. It's not always necessarily what artists want, which is I've learned. It's not necessarily the same thing, and I'm not an artist. So, and as I've already alluded to, one of the areas that we've struggled with is what's the balance between trying to be very, very innovative and trying different things so as to avoid being put into a single box of one type of content, but at the same time managing to be within a a certain world, a certain genre that my journal lives in. And we have to be very mindful of that. I want to finish by something that's going to be quite a departure from graphic medicine, but I want to tell you it because I give the graphic medicine world credit for this being in my journal. So this isn't graphic medicine, but I mentioned to you that when I started, we really had very limited medical humanities. That's not to say that On Being a Doctor isn't fantastic. It is, but it was only one genre. Having had such success with the graphic medicine section, that gave us the courage to branch out again, which we only recently did. And many of you know of what the Moth does with poetry slams, and many of you may have been at other types of story slams in New York or at other places. And so with a small grant, initially from the Macy Foundation, we had our first On Being a Doctor story slam. And we've been recording these live. These are live events. But then we put them up, all of this content, by the way, both the Annals Graphic Medicine, as well as all of these story slams recordings, which are up to 5-minute long stories that are just told by either patients or doctors about their, or nurses, social workers, anyone involved in receiving or providing healthcare. Their experiences are up on our website, and they're all freely available to anybody who wants to see any of this at any time. And they're live events, and I want to just show you just one example of one, if you'll bear with me for just a few more minutes, because I think that it really expresses how getting out of the hardcore clinical science that we do, and we're still doing it, and I'm proud of it. That's what I am by training. But you learn and experience things differently when you use a different part of your brain. And I know with this crowd, I don't have to convince you.
So my apologies that we weren't able to hear the music.
Not able to do it. So,
but I think Sarah may have corrected that. Can we give this?
Okay, great. That'd be great.
So we're going to try this again, but now it's not reading PowerPoint.
Okay. So I encourage any of you who are interested. So this was a terrific story told by a patient who is able to manage to tell the story of his own suicide attempt and have an audience of 100+ people laughing and crying at the same time. And a lot of a lot of you know that you can do the same thing with graphic medicine, and that's part of the beauty here. If we can advance one more slide.
Are we trying this once, or should we move along?
So I am sharing. Do you want to try the video?
Go ahead. Let's give it
got the time. We can try it.
Okay. Here we go. Let's see how this works.
Worth trying. Here we go.
Yeah, it won't be. This isn't going to work without the audio.
Okay.
Yeah, it's purely audio with his amazing facial expressions.
Dan,
So-
we're going to save questions for later, obviously, but just at this moment, can I ask if you'll be making this presentation public and shareable so that
It is all of this is shareable. So the
Fantastic.
presentation is shareable, and all, as I've said, all of our graphic medicine and the Story Slam events are at annals.org. For graphic medicine, you go to annals.org/graphic medicine, and it's all freely available to anybody at any time. So I just, if I can just advance. So I really, our experience, you can see here people enjoying these Story Slam events. And as I said, the graphic medicine community can take pride in the fact that all of this has pushed us towards doing more and more things like this, because it gave us the courage to try. And we are loving it. And so is our audience. And I think that, it feeds into what our mission is. Our mission as a healthcare community is to promote, and our journal specifically is to promote excellence in medicine and contribute to improving the health of people worldwide. I think that these contributions do that in a very important way that complement the randomized clinical trials that I publish, the new drug information, the report of toxicity of this or that drug. If the physicians, the nurses, the social workers, the administrators of hospitals, the policy members, the patients aren't using that part of their emotional repertoire when they bring their energies to healthcare, it's not going to work. All the science just kind of falls apart. So I need to be able to hold a patient's hand at the bedside in addition to being able to know what drug to give her. So I'll finish there. Happy to take questions. Sorry that a lot of this wasn't about coronavirus per se, but I must say, for me personally, it's if you won't mind the pun, it's a breath of fresh air not to be thinking about coronavirus for even 15 minutes. Thanks so much.
Thank you, Darren, and let's also thank Alice for their contributions today. I thought it would be helpful to know what spaces are out there, the Annals of Graphic Medicine being a huge one as we address coronavirus, COVID-15. So in my own mind, they slotted together. Let's move over to some of the questions that have been posed in the Q&A. And then with any remaining time, we'll open it wide so people who are already exchanging, I'm loving to see, already exchanging links and resources in the chat. We'll get to do a little bit more of that up until 4 o'clock. So the first question I think we could go right to, and this also can go to the audience, to the attendees. Do you know of anyone planning anthologies around COVID-19? That connects with the question I had for Darren, whether or not there's been discussion of publishing a collection of the Annals of Graphic Medicine. So can we touch on future printed possibilities, both for this moment and for what you've done to date, Darren?
I don't know the answer to the first half of that question as to collections with graphic medicine contributions regarding coronavirus or COVID-19 disease. With regard to Annals graphic medicine collections, sure, we would be excited to do that. It's always, quite frankly, whether it's feasible. So we don't need to make a profit, but we do need to cover our expenses so that we can continue to bring these kind of things to the world. Yeah, absolutely, we would consider putting together a printed collection, for example.
That's fantastic to know. Alice, have you seen anything on collected editions? I do know that there are a number of places that are calling for submissions. I don't know where they are in their process. Right. Quarantine is planning an anthology. I do know, being listed there by Patricia Anderson. Short Run Seattle, that was on the tip of my mind. Is doing those, but they are still in process. I believe they're still taking such submissions.
That's probably going to be a while, and it might even be kind of post. When all of this craziness kind of passed, which, could be quite a long time, which also, the anthologies take a very long time to make. So I would assume those wouldn't be coming up very quickly. But.
We have a question from Leah Mesimer. That's funny. I've never said her name out loud. Mesimer? Miss Simmer. She'd love to hear from Darren. Love to hear more about how you handle peer review for these. It takes significantly more labor to create a comic and then edit it later. So I'm wondering how you deal with both that and the question of expertise in comics as a medium. Yeah, so we're very fortunate to have Michael Green join us as a guest editor at Annals for this section. And so what happens is that a piece gets submitted, the hundreds of pieces that whatever come in a year. We will look through those initially, and then our editorial team, which includes both Michael, myself, as well as other physician editors, in addition to other people who are not physicians. We think that's very important to look at these. And we get different perspectives. We also send them at our discretion. We send them out to external reviewers. Those will be both artists at times, as well as, depending on the topic, a patient,
patient advocates, nursing. Some with regard to the portion of the question about what about editorial feedback and making changes, we're very mindful of that. I try it's a struggle at times to decide. You definitely don't want to be doing something where I say potato and you say potato. Let the artist say potato. It's her piece. It's not mine. Not to mention the fact that it's real easy for me to put in a letter, change this to potato, but it's hours and hours of work for the artist to do that. That's not worth it. The changes we will ask, however, and I can tell you there have been several experiences where I've known from either talking to the artist or seeing in their cover letter or otherwise just having a sense that this is how some of our editorial team viewed this, and I bet that the artist didn't realize that this is how it would be interpreted by some people. And we give that feedback back, and at the discretion of the artist, it's up to her or him as to whether they want to change it. Each time we've done that, it's been a very positive response, which in a sense, to sum it up, has said, oh my goodness, I didn't realize that's how it would be seen or misinterpreted. Thanks for letting me know. That way they've been able to change it so that their intended message has gotten across. Have I ever missed it? Who knows? There may be times where I interpreted it one way, had no idea that that's not the way the artist intended it, and it's out there in the world that way. But in any case, that's our process.
Thank you, Darren. I want to point out some other sources that are being mentioned in the chat. The Asian American Feminist Antibodies, the Annals of Family Medicine is putting together a COVID-19 collection. And I think we're breaking news here, Kendra. I haven't seen this publicly elsewhere, but that the Penn State University Press is launching a Graphic Mundi imprint that will be doing a COVID-19 anthology. So that is all fascinating to hear.
Terrific.
Are moving ahead. Claire Whitney had a follow-up question on the same note as this peer review question. Are there comic or graphic medicine methodological or procedural references that reviewers are looking for? Fascinating. Do you have any thoughts on that, Darren?
I would defer to my, you guys, the artists, on that.
Okay.
If you saw my doodling, you'd know that there wouldn't ever have been an Annals Graphic Medicine section.
Okay, fair enough. Claire may want to elaborate on that in the chat window. I suspect that maybe the question has to do with not just the art, but actually what sort of protocols there are in what you can show, can't show, what you could disclose, what you can't disclose. That's my guess, at least.
Got it. Yeah, I'm sorry. I had misunderstood.
No, that's okay.
We're a medical journal, so the human body is perfectly fine. If somebody some reader somewhere is offended that we show a part of the body, it's a medical journal. Thanks very much. Go look somewhere else. The only prohibitions we have there are times when we receive something that obviously is personal, or not only personal for the artist, but also they're depicting someone else's story. And it's extremely important to us to know that anyone who is depicted that might be recognized by anybody else, because our stuff is up, being seen throughout the world. We need to know that anyone who might be recognizably depicted in one of our pieces is aware that might happen and is giving permission for it. That's really the major thing. Then there have been some times where pieces have been submitted to us that we worried could be misinterpreted as providing inaccurate medical advice. And in that situation, obviously, given the banner that we're under and what I hope is a trusted name, we wanted to make sure that couldn't happen, that there wouldn't be anything inaccurate or misinterpreted as giving bad medical advice.
I had a question for Alice and for the attendees at large, but it occurred to me when you were breaking down your categories, what do we call them? The Jagger themes? Jagger's themes?
So MK suggested they should actually be named after Shadow. But
Okay. Sure.
I'm not important enough to MK. MK values.
You are. Of course you are. Here's the question. So going back to your educational theme, do you think that adults allow themselves to learn more readily if it's supposedly targeted to children? I mean, I've heard the argument the other way, right? I've heard this is too childish, too basic. Get back to me when it's something more professional and adult-like. And yet at the same time, I feel like when we need immediate answers, resources that are targeting children can be of incredible use to an adult. Have you negotiated that at all?
Well, so for me, and I mean, from what I've experienced, what I've heard stories, because I've heard lots of stories at this point, that generally it's a gateway thing. You know, someone said, oh, well, I read my niece's comic, I read my child's comic, or I read comics as a kid. And so, but as an adult though, like, you know, you're reading a child's comic and it's kind of like, oh, well, I'm not really reading it. I'm just kind of, you know, and kind of makes it a little more socially acceptable. But I do feel like at this point that a lot of the social stigma of adults reading graphic novels has, I mean, it's still there in certain populations, but in a lot of ways that it's, if you put something educational in front of someone in its comic form, they're just going to read it. And I think it's been interesting to kind of see people's reactions to the COVID comics, because people who, oh, I didn't realize that comics could do this. I've never heard of this graphic medicine thing. What is it? And that are just shocked, but they aren't, I mean, kind of once you put something in front of them, proof is in the pudding, I guess. Yeah. Because they're not, when they see those adult comics that are educational, they're not, oh, well, this isn't for me, I can't do it. But I do think that especially the NPR Malaka's comic, that it was kind of a gateway. A lot of people saw that. And so they could say, oh, well, you know, I'm just reading this for my kids and not for me. But
they even followed up with a story about how people are using the comic.
Yes, which was great. All the different languages, yeah. And the zines. There is a link to the zine too, and that's on the graphic medicine.
And how to build it, and how to actually cut it out and make it.
Yes.
With respect and deference to our panelists, I think the next question is something we have to open up wide. And I think in these last 10 minutes, we should open the discussion wide to the entire community. Kevin Wolf asks, is there a possibility that all the sanitizing that's occurring under COVID-19, perhaps very necessary, might be birthing future and worse pandemics of superviruses?
Not if you're hand washing.
Not through hand washing. I think he's talking about sanitizing in terms of chemical
and if CDC guidelines and a lot of the other guidelines of what people have putting out, that hand washing is superior to sanitizing. Going back to that microbiology course, those microbiology courses I took in my undergrad, that I know that was a big thing then, that this antibacterial stuff and widespread use of antibiotics and of sanitization using like hand sanitizer is bad. And definitely, well, I think that antibiotics are kind of a scarier thing than just a hand sanitizer. And if we are treating things like COVID with antibiotics, which I cannot imagine healthcare providers doing, that's the far scarier thing in terms of super viruses, anything's because, you know, with bacteria as well. That's kind of the concern, but I could be wrong. It's been a long time, but that's
yeah. I'll expand a little bit on that excellent point, Alice. So I do take care of these patients. So Alice is spot on. So it's very people get pneumonia, for example, and I actually just before this conference literally got off the phone with the wife of a patient who was distraught that the antibiotics might be stopped if it proves that the patient is COVID positive, and that's understandable. Your loved one is sick or you're sick, and you remember that, I had every time I get a respiratory infection, it quote unquote goes to my chest and then antibiotics get rid of it. It turns out that, as we all know, prior to COVID, the vast, vast majority of these infections are viral. Now they may be COVID as well, specifically, and that antibiotics do not help at all. And as Alice alluded to, all we do when we're using antibiotics in that setting is, to this exact question, we breed multi-drug resistant antibiotics. So not only for that patient, then when it comes around, but then our community at large, we have less ability to fight that bacteria later. So it becomes very relevant right now, while everyone is so scared that the docs are stopping antibiotics once it's clear that the pneumonia someone has is not bacterial, but rather a viral infection.
Okay, thank you. This is Kurt. Actually, I mistook Kurt Jeffert in our audience. Yes, if we want to continue this conversation and you want to keep track of people you've been talking with here, if you are a user of social media, whether it's Twitter or Instagram, we're continuing this under hashtag NEGM20. Now, of course, this video will be made available as a recording, but more immediately, you might want to reach out and contact people. I've been delighted by all the interactions and resource sharing that's been going on in the chat. And perhaps one of the wonderful graphic medicine enthusiasts that are here wants to capture some of those links and make them public ahead of the release of the video. I'm not going to volunteer anyone, but it seems like a worthwhile thing to do, because the information that both Alice and Darren and the collective mind have offered here, and the announcements, has been wonderful. It has been kind of beautiful, what we want from a conference space. But with only a few minutes left, I wanted to ask if there were any concluding thoughts or final questions before I do the sign-off for this afternoon.
Well, I saw, and there's a question from Melanie Grant with the Welcome Collection, and I just wanted to say really quick that I mean, love the Welcome Collection, and I actually saw some people that I follow on YouTube were going to be working with Welcome, but that of course got canceled because of coronavirus. But what I would say that one of the unique things the Welcome Collection can do is physical things. So if there are physical zines, physical copies of things that are being sold or presented, both now and later, that's something that that the Welcome Collection, because a lot of people just can't. And I mean, Welcome Collection has just done such wonderful things with graphic medicine, and so. But I think that that's kind of the unique thing, because a lot of places, I mean, it's just webcomics and freely available things, and so that's kind of be or things that are behind paywalls, and that's kind of that's what, with artist permissions, of course. So
you're helping me write the closing remarks already as we keep touching upon this web print parallel. I don't actually think they're oppositional. I think they do very different things, or they each have their strengths. But with graphic medicine, I want to say gaining attention, gaining purchase, we'll want to talk about how things exist and how things live out there. Unfortunately, I have to bring things to a close for the moment, but I think this was lovely. and worthwhile. It does conclude our first day of the conference. We will be back early tomorrow morning, 9:30 a.m. here on the East Coast. But I encourage everyone to continue the conversation on social media as you like, and bring whatever thoughts or inspiration you have in that forum back here. If you have any concerns or issues, please reach out to myself or Sarah Levin-Lederer. Can I ask one more time for your appreciation, however you want to express it, to Darren and to Alice and to a lesser degree, Shadow?
Stay safe, stay well, everybody.
You as well. Thank you all very much. This concludes the recording.